Friday afternoon. As I already mentioned, that the federal government yesterday declared that our COVID emergency has ended without any kind of fanfare. In fact, honestly, I haven't seen any news about it, which, it is what it is. So of course that doesn't actually change anything whatsoever, except a couple of things that I'll update. But let's do the usual thing, drop the questions in the chat. I have a couple of points for wellness, and we can go in a couple of different directions. I think what I'm going to do is I'm just going to keep giving you some updates and some components until we simply run into about 2:30. Nina, is that good? Half an hour, is it good for you today? Okay, well, I'll presume that the answer is yes. So updates, COVID updates first. There are a couple of things. So one, if you're worried about the vaccine and how is it going to be paid for, let's say that I told you that you should be waiting till, let's say, end of a summer or fall. So here's what's going to happen. I kind of had to research this a little bit because I was confused myself. From what I'm reading, it looks like that the stockpile of current vaccines, there's going to be no charges at all. It will last at least into a few more months. After that, patients who are not insured or on Medicaid will get vaccines for free. There will be a separate program that will be established by the government. They will be continuously purchasing Moderna and Pfizer vaccines at the current prices, which are about $25 a piece, I believe. Of course, this doesn't apply to Mark at all. It's just US starting. And so then everybody else, if you have a private insurance or Medicare, they have currently negotiated prices. Anybody wants to guess what our insurances will be paying for our COVID vaccines starting the moment they run out of the current free stockpile? Throw the numbers in the chat. I'm just curious what. Okay. Well, that's a good question, Linda. I'll come to that. I see your question. It's a very relevant question. Anybody? Throw the number. I love seeing numbers. All right. How about we'll see some votes? All right. Okay. Well, Mark, come on. Seriously, you looked it up. Okay, so it's $130 some. Okay, well, Lisa was quite correct, quite close. Okay, so yeah, so they basically jacking up the price from a current price 5-fold and whatever. So it's like, it's basically tells you that the typical, yeah, right. I mean, why they're doing this because they can. And apparently there's not a lot of discussion about it. So everybody said, sure, we'll pay you that amount of money. And like the insurance is just going to shell this amount just because. Okay, so that's in news number one. If you have not gotten your vaccine, don't worry, it will be covered one way or another. They are expecting that there's going to be no co-pays for every insurance for this vaccines. That's the statement that I read wherever I was reading. I think it was Washington Post. I'm not going to believe this until I see it because the new vaccines coverage can sometimes be quite tricky and may require some approvals. But I'm going to just hope that that's not going to be a concern going forward. Okay, so that was point one. Point number two, I was going to talk a little bit about our long COVID experience and some of the things we're about to do. So we've grown our program, which you can see in the link, and I'll repost it in case somebody joined us a little bit late because I see people are joining. So I just reposted. This is our CIM long COVID program. We've just added the second group per week because the first group is now so big that we really can't keep up. And the way this works is it doesn't matter where you are. It's 1 hour a week, which about half of it is some kind of quick didactic. For example, yesterday we discussed how brain inflammation after COVID occurs and sort of what happens with the glial cells, which are glial cells are the kind of immune system cells that are supposed to clear the junk, clear the free radicals from the brain, and what happens in a long COVID when that actually doesn't happen. So that was one thing that I was going to talk about. And, we've seen some really interesting success stories there. And particularly, I find that success stories have to do primarily when person not only feel completely supported, but when they figure out certain internal connections. Let me give you an example. When they been looking for some solution for their problem, but the tools that they were given by their doctor were really not working. And then they start looking outside and they couldn't find anything. And they would listen to a particular presentation or people discussing after, like just a group chat about particular tools. Like yesterday, we spent a good amount of time talking about osteopathic manipulation for headaches. It's called craniosacral approach, which 2 people in our group have done and felt some relief with. And so we were discussing. And so we often find that this is how some people find an interesting solutions that tend to work. And then about 2 months ago, we were approached by a Peace Corps to have their volunteers who develop long COVID being treated at CIM under emergency rule, meaning they would fly them, put them at a hotel near our clinic, and then have them treated at our clinic. So we've treated one patient like this, and we're about to start publishing this case because they flew her from Guatemala. She could only walk about a block without getting short of breath. When I saw her in the office, she could get up, walk from my office to the waiting room, and then she had to sit down. And now 45 days later, she just hiked on the weekend 2.5 miles without getting short of breath. So we're clearly seeing some patients do really well very quickly. I think for her, because the insurance was covering, we did a lot of things simultaneously. She got nutritional infusions, she got acupuncture, she got support group, and she had low dose naltrexone, and then she had some B vitamins, fatty acids. And seemingly like that package worked very quickly for her, but she's also quite young. She's in her early 30s. So based on this model, we actually just had a board meeting for AIM, and also before Dr. Frame left on vacation, we decided we're going to try to apply for a very large health services grant of about $1 million. We don't know what our chances are of getting it, but we will try. And if we do, then we will make this program open to the entire DC Medicaid population. However we can structure it. So this would be a partnership between GW to do the research aspect, AIM to deliver treatments through our affiliate providers, and then CIM to also provide an expertise. So it will be kind of a complex infrastructure for the delivery of services. So that was one update that I wanted to mention. So the second update, I just reported a pretty the longest Zoom podcast I've ever done on the harms of oxalates after I read this book, and I met with the author of the book, Sally Norton, and did a full podcast. I will put that out. I didn't have time to sort of organize it and type everything I wanted and put it on YouTube, but I do want you to keep an eye on for when it comes out. It will be on my YouTube channel. If you haven't subscribed yet, put plug just so you don't miss it. The bottom line, the oxalates is a very concerning problem. We're seeing massive overlaps between, say, Lyme and mold, and often oxalates become the primary problem, and it takes quite a while to fix the issue. Apparently, the book is so well received. In less than 6 months, it got a 4.8 with over almost 550 reviews on Amazon, way better than my book ever did. Just saying. So and there's a lot of cases there saying how much the book helped the people, and so stay tuned for that. Part of the reason I decided to bring this up is the fact that there's a lot of misconception lately, particularly around the vegetarian diets, or rather vegan diets, and the high amounts of greens and vegetable intake versus all kinds of other diets. The reason I thought this would be important to record is to show a possibility of a problem when you consume a lot of vegetables and greens. I'm not saying you shouldn't be doing this, but I'm saying that the way we ate for thousands of years in a very mixed way, often not eating certain foods and then eating others, that's what our body's used to. And personal experimentation, doing green smoothies and all kinds of things, this may not be for everybody. So I'm just putting it out there more as a worrisome, and in my opinion, oxalates is a real deal, even though Andrew Weil disagrees with this. I'm not afraid of saying that. I have done my own due diligence researching this topic a while back, and I do think oxalates is a real issue. So that was my quick second topic. So let me turn to questions, and then if we have time, I have one other topic. If we get to it, it's great, and if not, it's perfectly fine. We can review it at some other time. All right, so vaccines are free in New Zealand. I mean, in any reasonably developed country that has, that is developed, the usual healthcare setup is a little different, where either you have a single payer or you have some kind of a centralized several insurances, but they will make most of the, if not all of the preventive care free. US is one of very few exceptions where that's not guaranteed. Okay. Okay. What helps with extreme fatigue and insomnia in long COVID? And should someone with long COVID get a vaccine now? Okay. That's both questions are wonderful. I would like to start with the vaccine question, because in some way I think it's easier and quicker. So to me, whether you have long COVID or you don't doesn't change the frequency of vaccination. Remember, long COVID doesn't mean that somehow you still have circulating virus, or that your immunity for whatever reason continue to be upregulated due to the presence of anything virus related. It's thought to be more if there is an inflammatory component that's an autoimmune state at that point. And so in that sense, you should be getting vaccine like everybody else, in my opinion. Now, if you feel that you're extremely sensitive to the vaccine, meaning there's been a concern previously, we see this a lot, when patients would say, I got my COVID shot, and then my long COVID got worse. We also have seen pretty commonly, patients will say, I got my shot and my long COVID improved. And it seems to be unpredictable. Like, I can't really know who's going to do what, except for one thing. I would say that if the patient is toxic to me, so if I use the word toxicity meeting with someone after I assess them, I would probably tell them not to get the shot, because I've seen people who appear toxic on presentation, when you give a shot, they do worse, especially if they can wait. So if the person is young, if the person has low risk, if the person had their COVID within 12 months, those are all protective features. Now, if you're years out, let's say more than 2 years out of either the COVID or the vaccine, you should probably start thinking, will you be getting vaccine or not? That's the current best answer I can give. Now, the second part of this question I think is really important. So it's a very long answer, actually. There's a lot of things that can help fatigue and insomnia. I would say that definitely graded exercise, slow but steady, would be good for both things. Cannabinoids for insomnia probably would be on top of my list. And depending on the situation, I may give, if you're in a state where cannabis is legal, medical cannabis is legal, I may give a low dose of THC only for sleep, just like somewhere between 1 to 5 milligram equivalent of sublingual. It's possible that just doing CBD, if you're in a non-legal state, or CBD plus CBN, those are the things that I probably would start considering almost immediately, especially if insomnia, if I feel strongly, which is usually the case, linking insomnia to the fatigue. The more you sleep poorly, the more you're fatigued. Then I would go after insomnia very aggressively, hoping that the fatigue will get better as well. Other than that, the things that definitely worth exploring, melatonin, specifically in long COVID, there's some data that melatonin for long COVID as an antioxidant can work. But remember, melatonin can also work for some patients for insomnia. It wouldn't be my potentially first choice, and it usually doesn't work for a long period of time. It's kind of a temporary measure. And melatonin is not a good tool for chronic insomnia. It's a very good tool for acute insomnia, like jet lag, for example. So those are the quick things. I also love to use magnesium at bedtime, particularly ionic forms of magnesium that are absorbed rapidly and do not cause diarrhea. So something like Natural Calm. I know it's recorded, but that's the brand I use. It's okay. So those are the things that I kind of immediately come to my mind. And Linda, I can answer this a lot longer, and I don't want to, because I think I want to make sure we get to other things, and I see there are other points and questions. So, okay. So yeah, Irene, that's exactly my point. We've been eating animals for most of our existence. I think stating that we will stop eating all the animal containing foods is, in my opinion, is misguided, and it's not going to be beneficial for the humans or the planet in the long run unless we figure out some alternative models, which it's beyond my scope of expertise. But I feel strongly that we've coexisted with animals. We ate them and we supported them, and I think it's a more of a balanced question rather than extreme diets. So I will also point out very simple reality. Those of you who've read Forever Young by Mark Hyman or Outlived by Peter Attia, you will know how aggressive they are about pushing leucine and pushing brain chain amino acids and creatine as a key protein or amino acid messaging signals for people over 65. And without them, you basically at the much higher risk of losing muscle mass, and you unfortunately to try to get that amount of protein from plants is going to be a very complicated endeavor. You would need to eat such an exuberant amounts of plant protein that you definitely will have to supplement as protein powders if you're considering staying vegan. I'm just going to put it out there, and that's not necessarily my expertise, but I completely subscribe to that, especially given that as we get older, our protein intake requirement goes up. So so that any toxicity, and for sure oxalate toxicity can show up after COVID. I often kind of joke to people, I say COVID, long COVID, simply highlighted all the inefficiencies of all of our systems before, and it just pointed out and made it more up there that whatever the other problems you've had, and you may not have had a lot of symptoms, but now after COVID, you actually have them because they kind of blossomed, because they're on top of other things. So Linda brought up a very good point that if you've been, say, oxalate toxic, and then you got COVID on top, it could totally tip you over. And now you have a lot more symptoms and the management becomes more complicated because you have to deal with sort of combination of factors. So that's definitely true. Okay, can you please say a little more about oxalates and how to avoid them? Okay, so it's a very big topic. If you really want to know, don't get the book, because I think that's why she wrote the book. I mean, it's very detailed where the oxalate, what their history. Oxalates come primarily from plants. There are different forms. There's oxalic cristates, there's oxalic acid. Plants have different forms. Plants use the oxalates for protection because the crystals are very sharp, and so when an insect tried to eat the plant, then they bump into those crystals. But guess what? When we eat those foods, they bump into our stomachs, so they cause micro trauma. There has been some work done, but very little outside of kidney stones. So the oxalate kidney stones that about 10 to 50% of population will have at least once in their lifetime is quite well researched. But beyond that, we don't actually know how damage to different organs from oxalates can occur. So it's a topic in itself. If there is a general interest after you view the video, by all means, I can bring Sally, and I'm sure she'll be happy to talk to the group and do a Q&A and have her kind of engaged. She's highly energetic and very invested in this topic, and everything that's ever wrong with the humanity in her mind is an oxalates problem, which I think it's really important for someone to truly believe what they do and be very, very energetic about it. So just putting it out there. Jennifer, I don't know if that's helpful. Oxalate is a great mimicker. Just like lime, it can mimic pretty much almost anything. That's the problem. The problem is it's sort of how do you it's like lectins is another one of those topics, right? So I just chose oxalates today just because I just finished doing the podcast on that. There are other topics the same way. So the other thing I promised to myself to put in there, and I haven't. So those of you who already seen my video on this new app for long COVID, it's in this development stages, but I'll put it in the chat. It's an AI for long COVID, and yes, there is an AI even for long COVID. So basically, it's just a highly high quality resources out there like Andrew Weil resources, and then some of the our clinic resources that basically you type in the question, I feel bad, what should I do? And then you'll get some answer that will be do this kind of breathing. It's a new thing, right, with the AI. So check it out. Okay, let's see where we go next. Okay, is there any further news of the implication you shared last week that showed that people who have stronger antibodies than were? Well, guess why it's not all over the news? Kathy, come on, you've been with us for how long, and you're asking this question? Seriously? Like, it's funny, when I posted that video, we didn't promote that video, and then suddenly I wake up one day and there's like 3,000 views, and most of my videos are like a few hundred views. I was like, what the hell? So somebody shared it somewhere, and then it took off from there. And then I start getting some of the, like, you can go there and check it out. It's pretty funny. There's like a couple of people saying, what the hell are you talking? You're going to kill people by this messaging. I'm like, me killing people? Like, did you read the study? And then there were like people saying, oh, finally, one doctor had courage to say that vaccines are not better than natural immunity. And like, there are all kinds of crazy comments. I try to, when somebody put crazy comments, I try not to engage. I just pointed out to that person saying, your point has nothing to do with the video. By all means, it's a free country. Put whatever statement about me, but just FYI for the readers, this has nothing to do with public. The early immunity has nothing to do with what the study was about. And the fact that, yes, if we'd have vaccine at the beginning of the pandemic, we would save millions of lives, but that has nothing to do with this study. So I don't have any further updates. I will try to keep an eye on the sort of what's happening. Usually I kind of find this randomly. By all means, if you find something, I highly encourage you to send me the study you found for me to review. It enriches everybody's experiences. I know some of you are very good at doing this, and I welcome and I hope we'll continue to do that. So for sleep, you mentioned a class of drugs before mentioning THC. Did I mention class of drugs? Well, I said cannabinoids. Cannabinoids is a category of different molecules. Some of them are psychoactive or psychotoxic like THC, but some of them are not, like CBD. So maybe that's what you mean. So yeah, the cannabinoids is just a general term of active ingredients coming from plant cannabis. I'm not supposed to do that, but Linda, you by all means do get my book. I can put that for you in the comments if you're interested in this topic more. How do you know if you're toxic? Great question. So, well, there are hints of particular symptoms. There are different scales. Like I do want to give plug to Sally, what she did in really good in part of the book. She actually created a self-quiz. Basically, you check boxes things, and if it pans out that, then we do the same with a lot of things. We do that with lots of different states. Institute for Functional Medicine has been using this MSQ-9, it's kind of a toxicity scale for many, many decades. So there's a lot of ways of thinking about it, but I generally like to say that if you have multiple organs affected at the same time, like you're sluggish, your metabolism is sluggish, your digestion is sluggish, your excretion is sluggish, anything you eat that's contaminated, or you get into any kind of a toxic environment, like you drink a glass of alcohol that you could handle before with zero problems. Now you have a glass of alcohol and you're just completely like fatigued for the next couple of. So those are all hints, but to take it further in, you would need to actually try to do a workup, and there are different ways that the tests can help us to figure out if you're toxic. Some very simple markers like GGT, for example, it's one of the liver markers, but then there's also some much more complicated markers that have to do more with free radicals and oxidative stress. I'm almost out of time. Right, so Dr. Gandhi did a lot of research. I think he did more research on lectins than oxalates, but definitely that is there. Yeah, COM is a very good magnesium source. Thank you. So sometimes what happens when you take magnesium without other cofactors, you need other metabolites. So like usually I like to give some cocktail at bedtime that would has B6, sometimes B12 in small doses. And I also like to give 5-HTP or tryptophan. Sometimes the issue is, you're not converting very well serotonin to melatonin, and so you're lacking cofactors. And I've heard of this before. Usually when you give products that are calming, that are allowing for the neurotransmitters to move forward, that happens less. That's just my opinion. I don't know if there's an evidence for that. All right, natural immunity has always been stronger than the pharma product. We should kind of quote that somewhere, but I'm afraid of quoting anything like this anywhere in public, because you get interesting comments. Yet there was another study I shared which shows that people who got COVID are more susceptible for infection. Well, that's I think it's different things. So there's probably people who almost never got COVID or never had symptoms of COVID, and they're just naturally much more immune against it. So obviously, if you've had it, you're not in that category. So there's studies that have shown that probably you're basically looking at the bias-skewed population. The Lancet study didn't address that. The Lancet study basically said, it basically compared natural immunity to vaccines, saying that in many categories, natural immunity was better to protect you against the next severe episode, which is the book you're showing on the screen. I'll put the link in the second in the chat. And I'm out of time. I promised I'll end at 2:30. I'm almost on time. And yes, good point. The carbonation can be a problem. So if that's the issue, take some calcium, magnesium citrate at low doses in capsules. That's my second favorite. And you just titrate it up to the soft bowel movement in the morning. You take too much and your bowel movement will be a little beyond soft, so back away. All right, Nina, sorry, I'm passing baton to you while I'm talking about poop. I know it's not very exciting.
All right, thank you. It's great to be here again with everyone. I was here last Friday. It's good to be here again, and happy Mother's Day weekend, or to the start of the Mother's Day weekend. So today we'll be practicing 3 mindfulness meditations. We'll start with the mindful check-in, and then we'll move into the body scan and close with the loving kindness meditation. I'd like to start, though, by giving you a framework for understanding what mindfulness is. So mindfulness is composed of 3 elements: intention, attention, and attitude. With intention, we're purposefully deciding to pay attention to present moment experiences. So getting more intentional about paying attention to the present moment. And that can be internal or external experiences that you're noticing. The second element is attention. So actually paying attention. And so with mindfulness, you're cultivating 2 ways to pay attention. You can pay attention by zooming in and focusing on one object of attention, or you can pay attention by zooming out and broadening your awareness to include other objects of attention, things that are going on internally and externally in your environment. So you're cultivating the capacity to pay attention in these 2 ways. And there's a lot of benefits cognitively and health-wise that come with that. The third aspect is attitude. And crucial in mindfulness is paying attention with attitudes of non-judgment and openness and curiosity and kindness towards your experiences, towards yourself. And I think that's why I love mindfulness so much, and why the path has worked so much for me, because it has really taught me how to be kinder to myself and less judgmental. So now we'll move into the 3 short meditations. So go ahead and get into your mindful posture. So you could be sitting or standing, lying down, whatever is most comfortable for you. I like to remind people that you want to be comfortable and alert as you can be. And so you can close your eyes or simply just have a soft gaze downward. And as we move into this mindful check-in, let's start by taking a few deep, calming breaths to help us transition into this meditation. So when I say calming breaths, I just want to remind everyone that means you'll take a deep breath in through your nose, a slight pause, and then a long, slow out breath out through pursed lips, out through the mouth. And that will really calm down the nervous system, especially if you go long and slow on the exhale. So let's take a deep breath in through the nose and a long, slow out breath out through the mouth. Let it go. And another deep breath in, deep breath out, releasing, letting go. Let's do one more. Breathing in through the nose and out through the mouth, releasing. And then returning to the natural rhythm of your own breathing as you're ready. And another way to come into the moment and to ground ourselves here is to start to bring attention to the touch points of the body. So you can feel the feet making contact with the floor, your legs, your buttocks making contact with the chair or the cushion. Noticing your hands. Perhaps your hands are contacting your lap or whatever surface they're resting upon, perhaps softening the hands. You might notice your back making contact with the back of the chair. And to bring more ease to the body, see if you can bring the shoulders, start to let the shoulders relax down away from the ears. And relax the face as best you can, starting with the jaw, letting the jaw release, perhaps letting the tongue go loose in the mouth. Softening the eyes and the eyelids and the forehead as best you can. Sensing into the entirety of the face and just letting it be. And now bringing attention to what's going on in your experience right now. What are you thinking, feeling? Perhaps there's a mood or a tone to your thoughts. Seeing body sensations, sounds. Whatever else may be coming into awareness, simply allowing and letting it be, because this is simply how it is right now, moment to moment. bringing a friendly and open and kind attitude towards yourself and your experience as best you can. And now zooming your attention into one anchor, the anchor of the breath, be it the belly or the chest or both. Inviting you to feel the sensations, the movement of the breath, perhaps even placing your hands on your belly or your chest. And seeing if you can feel the rise and fall as the breath comes in and as it goes out moment to moment. And when you notice the mind is wandering off into other distractions, that's perfectly normal tendency of the mind. You can simply note that to yourself as wandering or thinking, and then bring attention back to the anchor, the breath. Each time you notice the mind wandering off in a gentle way, it's the essence of the practice. And now zooming out once again, broadening our awareness to getting a sense of the body as a whole, noticing the body's posture, position, feeling the whole body sitting here breathing. Expanding awareness even more now to include sounds around you, thoughts, feelings, images going through the mind. Anything else coming into your field of awareness. And now we'll move right into the body scan. So if you want to take a moment here to adjust your posture, recenter, go ahead and do so. So with the body scan, I'll be inviting you to take your attention to different regions of the body. And the work is just to notice the sensations. There could be a tingling, heaviness, a lightness, a warmth or coolness, pressure or pulsing. There may be a whole array of sensations you're noticing or no sensations at all. So you're just simply observing with and sensing with curiosity and kindness. And so in the body scan, we'll start now by taking our attention all the way down the body, scanning attention down the body, all the way down to the feet and the toes of the left and the right foot. And notice top and bottom of the feet. The inner arches and the heels. Allowing whatever is here to be here. Sensing into the entirety of the feet and now the ankles, the ankle joints. Getting curious about what's arising. Shifting attention now, spotlight of your attention up from the feet and the ankles into the legs. And start by noticing the lower legs, the shins in front and the calf muscles and back. And then taking attention up to the knees, perhaps softening the knees. Noticing the inside and outside sensations at the knees. Breathing with it, moment to moment. And from here, taking attention now to the upper legs, perhaps noticing the quad muscles and the hamstrings, the inside and outside sensations of the upper legs. Temperature, touch, pressure, coolness, warmth. What is here? Allowing and letting be. And then shifting attention up to the hip region of the body. Perhaps this is an area of the body you don't pay much attention to. So noticing the hip joints, and now broadening awareness to include the entirety of the legs and the feet, hips. And now completely shifting attention from this region of the body and moving up to the torso. So we'll start with the back, noticing the lower back, the upper back, and the mid back. This is an area of the body where we tend to hold tension. So see if you can get a sense of taking a deep breath in and breathing that space into the back. Breathing out and releasing any holding on, any tension in the back region of the body. Meeting it with kindness. And then letting go of focusing on the back, taking attention around to the front part of the torso. So noticing the abdomen and the chest. Perhaps softening here. Might be noticing your breath, this region of the body as it comes in and as it comes out, moment to moment. And then taking attention up to the shoulders, softening the shoulders, and then moving attention down into the arms and the hands. So start by noticing the upper arms, the elbows, lower arms, wrists, and hands, fingertips, thumbs, the entirety of the hands. The entirety of the hands and the arms, shoulders, allowing and letting be here as you're breathing. Perhaps letting go. Breathing. Sensing, allowing. And now moving, continuing to move and scan attention up the body now to the neck, perhaps softening here. Feel free to move the head to stretch out the neck. Maybe you want to lean your head down towards the right shoulder, right ear to right shoulder. Head comes up, you can drop your head down towards your left shoulder, or left ear to left shoulder. Head comes up to center, gently bringing the chin down towards the chest, only as far as you can go. And then bringing the head back up to center and gently bringing the head back, ever so gently, stretching out the front of the neck and honoring the wisdom of your own body, only doing what's safe for you, and then bringing your head back up to center. Moving attention now up to the face, so starting with the jaw, relaxing the tongue and the mouth, perhaps releasing the jaw, opening the mouth and just letting the jaw go. Noticing the cheeks now and the nose, the ears, the eyes and the eyelids, perhaps softening here in the forehead. And now the top of the head. Noticing the body as a whole. So taking attention from the top of the head and slowly scanning attention all the way down the body, and out to the bottom of the feet and the toes. Enveloping the entire body, breathing with awareness, moment to moment. We'll close now with a very brief loving kindness meditation. So loving kindness is a practice designed to increase compassion and feelings of goodwill to ourselves and others. So if you like, you can place your hands on your chest, on your heart center. And as you're doing that, perhaps you're feeling the warmth of your hands, on your heart, on your chest. It's a way to bring warm feelings, feelings of positivity to the mind and body. And I'll be stating a few phrases of loving kindness, wishes. So we'll start by you will repeat the phrases after me, and you'll be directing these phrases towards yourself. So may I be happy. May I be happy. May I be peaceful. May I be peaceful. And may I be well. May I be well. So we're not trying to force anything here, just planting these seeds of caring towards ourselves, wishing ourselves the best. May I be happy, may I be peaceful, may I be well as much as is possible for me right now. Notice how the body feels, taking in any feelings of warmth and positivity. And if you're not feeling loving kindness, that's fine too. Just allowing and letting be whatever is arising to arise. And to close this meditation now, we'll send loving kindness wishes to all beings, because all beings wish to be happy and peaceful and well, just like us. May all beings be happy. May all beings be happy. May all beings be peaceful. And may all beings be well. And whomever may be suffering, may their suffering ease. May all beings be happy and peaceful and well. So just noticing how the body feels now as you're sending out these wishes of goodwill in this expansive way. And as you're ready, you can gently start to transition out of the meditation. Very gently opening the eyes. Perhaps you're wanting to stretch, move around. Welcome back. Have a wonderful weekend, everyone. Again, a happy Mother's Day, and take good care.
Happy Mother's Day, everybody. We'll see you next Friday. I don't know if Janet is still here. What do we have next Friday,
Of
dear?
course, I'm still here. Eliza Scharf will be with us. Just a reminder
Oh,
for
great.
You can remind them about Eliza.
So yeah, she's a psychologist with a practice in Baltimore area, and she does a lot of very interesting, unique approaches, and I think including transpersonal approach and some groups. So I'm sure she'll be talking to us about some of the mental health aspects of wellness, and who's doing the mindfulness? She does?
Eliza's doing the mindfulness as well.
Awesome. Yeah. And she also does a lot of mindfulness in her practice. So we're excited to have her back. It's hot. So enjoy outside.
Stay hydrated.
Stay hydrated. Bye.